Hey guys, my name is Russell Linville. This is 2 Cent Tuesday, and this is part of our Become a Better Human project where we're trying to do a video series every day. And on Tuesdays, we talk about, maybe some topics that have made me think in the past, what's my opinion on this? And so I kind of tune in and give my 2 cents on these topics. Now, today, what I want to talk about is ACL reconstruction or repair. Return to sport timelines. When do you let your people go back? It's a multifactorial decision, but what we're noticing is a lot of these people, will get, and so we're a very specifically sports-oriented facility. And what we're noticing is that people go back too soon, and we'll try to touch on what too soon means, have a really high risk of re-injury, and the literature supports that, unequivocally. So we get people back, and we do all these testing on these people's ACL from all around the local area. I have a biomechanics lab that we take patients through, and we assess their readiness to get back to sport. And so what we're noticing is that if you don't meet some certain criteria, such as the big one's quadriceps strength, if you don't have full terminal knee extension or knee range of motion, or you have poor squatting or motor control patterns, or if your joint flares up, when you're doing an activity, let's say that you're starting to weightlift again or starting to jog again, and every time you do that, your knee swells up on you, and it takes a day or two to come back down. All of these categories are suggesting to us that you're probably not ready to go back to sport. You've got a weak quad, your knee's swelling on you, you don't have full terminal knee extension, and you have poor motor control. And so if you just think about those statements, that's leading you up for failure. And our job as a physical therapist or a clinician, or if you have been discharged from therapy or your patient's been discharged from therapy and now you're a strength and conditioning coach working with someone that has a recent history of an ACL reconstruction and they've been cleared by their physical therapist or their physician, and you're noticing these things are happening, you need to have a discussion with the patient that, hey, I know you've been cleared, but I don't think that you should be heading back to sport quite yet. And so I think for the longest time we thought that 6-month mark was usually when people can get back to sport and be okay. And as the years have gone on, we're seeing over and over again these people that go back. We were thinking 7 months for a while. If they go back for 7 months, they're at huge increased risk of re-tearing. And now really the recommendation is if they go back for 9 months, they have the risk of re-injury is very significant. There seems to be something about that 9-month mark, and I don't know if it's because there's enough training that's occurred, but the literature suggests that 9 months should not go back before 9 months, no matter how strong you are, unless you assume the risk, the individual risk, that you could get re-injured. So I guess where we're going here is if you're a clinician and you're looking at an ACL rehab protocol and you say, okay, the physician protocol says at 6 months this person can start doing return to sport activities. I really want you to think twice about what that means, and I want you to think twice about how you assess and get people back, where we have these functional tests that we can do to see if someone's ready, but they probably need a little more time and a little more detailed strength and conditioning program with good periodization, plan of hypertrophy, and they need to have graded, exposure back into sport, rather than saying, hey, when you get to 7 months, based on your protocol, if you're feeling good, we're going to get you back to sport. And never tell an athlete the first day they come in after an ACL reconstruction, when can they get back to sport? I give them very, very general timelines, and I pretty much always say, hey, it depends on how your testing goes. But usually between that 9 and 12-month mark is when we feel comfortable as clinicians, as long as you're hitting all of your goals to allow you to get back to sport. So next time you have an ACL reconstruction patient, whether it's fresh post-op, or you get them 3 months in, or you see them at the gym, or you're a strength conditioning coach, now you're working with them 8 months out, really I want you to think about when and how you're going to communicate with this patient on how they get back. And what we'll do tomorrow is we'll go over on our Nerd Out Wednesday is we're going to go over some statistics on getting back from an ACL reconstruction and what are some appropriate tests to do, what are some things to really think about in terms of timelines, and then maybe some talking points with the patient and discussion on why you might be, what they would think is holding them back. I think it's more of a protection than holding them back. It's a good communication to have. So thank you guys for tuning in. This is 2 Cent Tuesday, ACL reconstruction. They're complicated. We'll figure it out. We got this.